Hello, everyone. Thank you, everyone, for joining. As I said, I hope everyone can hear me well. I'm very excited to welcome you to this first webinar of our neurosurgery course designed for junior doctors and hosted by Mind the Blip. My name is Andrea. I'm the course organizer as well as today's host together with my colleague Mo in the screen. I'm a neurosurgery junior clinical fellow at St. George's Hospital in London. And some of you might guess I'm originally from Colombia, while Mo is a final year medical student at St. George's. Before we start, some housekeeping rules. So we are going to start with the presentation that will take around 30 to 40 minutes. And then if there is any burning question, we can interrupt our speaker. Otherwise, we can go through all the questions at the end of the session, and Mo will be moderating this part. As I understand, due to the platform design, your question needs to be submitted through the chat. So I hope you all can see the screen. So if this is the first time using MedOwl platform, remember that you need to use an institutional email to confirm your account in order to post questions in the chat. I think that's probably in terms of the housekeeping. So, and once again, I'm absolutely thrilled to see so many of you interested in the fascinating world of neurosurgery. As I've mentioned before, this is our first webinar out of 8, and throughout the course, where we are going to cover topics designed to support junior doctors with the management of neurosurgical pathologies in acute settings, as well as help you in the national selection application process. We understand the pressures and challenges faced by medical students and junior doctors, which is why we have tailored this course to support your needs. The emphasis of the course will be in the practical knowledge that you can apply directly into your practice. So remember, the course will be delivered by senior neurosurgery trainees and consultants. They are primarily based in London hospitals. The course is going to run from July to October, and we're going to have 2 sessions per month. So I hope you all have seen the program already. Otherwise, we can post it in the chat. And as a reminder, each webinar requires a separate registration. So look for them on MedOwl and register for as many as you want. I hope all of them are interesting for you, but I know that some of the topics could be familiar already for you. And lastly, each attendee that submits the feedback will receive a certificate of attendance through email. So you will receive a feedback request after the course today. So anyhow, I think it's time for me to introduce our first speaker. We are privileged to have with us today my colleague Simon Williams. He is a neurosurgical trainee at St. George's who is going to share with us his recent experience and first-hand knowledge of applying for neurosurgical training. As a trainee, our speaker understands the unique challenges of the application process, which many people find quite daunting. I would like to thank you, Simon, for taking the time to share your expertise and lessons with us today. I encourage everyone to listen and ask questions following Simon's presentations. So without further ado, I invite Simon to take the stage and tell us all about applying for neurosurgical training. Simon, the stage is yours.
Oh, fantastic. Thank you, Andrea. Hi, everybody. I'm Simon. As Andrea has said, I'm one of the neurosurgical trainees currently working in London. I'm based at St. George's Hospital, which is in South London. And I'm really, really happy today to give a chat on getting into neurosurgery, as well as what neurosurgery is like and neurosurgery from a training perspective. Before I do just want to say a massive thanks to Andrea and Mo. I had a look through what this course offers recently, and it looks like it's a really, really fantastic course covering the basics of neurosurgery. Neurosurgery is really badly taught in medical schools, so courses like this really, really are a great opportunity for you guys to get involved and learn a little bit. I've had a look at some of the speakers as well, and it generally looks like an excellent course. I'm sure you guys will be aware this is the first in the schedule, so if there are any tech issues, you will just have to bear with us. I'm a bit of an old man now as well, so let's see if we can get this working. All right, I'm going to try and share my PowerPoint screen, and fingers crossed that'll work. Any luck? No.
Can't see anything, Simon.
That's all right. Let me see if I can share my screen. You guys might get a little look at yourselves just now. Can you see anything now? No? Oh, see, we knew this would happen, didn't we? Well, all right. I'm not sure if I can get this loaded up. Maybe Andrea will be able to do it for me. Is that you doing it? Thank you so much. All right. This is going to be a little bit, next slide, please, then, a little bit like this COVID speeches or whatever. Another thing to say, by the way, is, guys, there's only about 20 of us here, so it's quite a nice sort of small group. So if anybody has any questions, please do post them in the chat, and Mo can just point them out to me and I can answer them as we go along. There'll be a little section for questions at the end as well, but I think it'd be quite useful just to get your questions out there, and I can try and answer them as best as we go along. Perfect. Okay, yeah, so without further ado, we'll go on to what we'll cover. Next slide, if you could, Andrea. Perfect. So what we'll go into today is a little bit about neurosurgery, what neurosurgical training is like, what it entails, and what the specialty is like, so that you guys can get a bit of a broad understanding of what you're actually getting yourselves into. After that, I'll talk for quite a while about the application process itself. Now, it may be a little bit dry at times, but I personally think knowing about the application is one of the biggest barriers to actually getting in, knowing what you have to know and what you have to sort of build your CV up to be in a good position to applying. And that includes the individual application, the MSRA, which is an exam that you have to sit if you're applying for neurosurgery, and then finally some tips about the interview. I'll then talk a little bit about how you can best prepare, some useful resources, and then, as I said, we can go through some FAQs at the end. A really little bit about me, just quickly, just for some context. So I was born in South Wales, but moved to near London when I was very young in a county called Hertfordshire. I studied medicine at Birmingham University from 2013 to 2019. And whilst I was there, I was really lucky to have the opportunity to spend a year in research looking into coating titanium cranioplasties with antimicrobial peptides, basically trying to reduce the infection rate with that. It was really, really good fun, but the point is, it introduced me to neurosurgery at a relatively young stage in my medical career. And throughout med school, my sort of love of neurosurgery started to build and go on from there. I did my foundation years, my FY1, my FY2 years in Birmingham at a trust called City and Sandwell, which was fantastic. I didn't do a neurosurgery F2 or F1 job. I applied to neurosurgery in my F2 and was very fortunate to get a number, but it was one that was quite far away and not suitable for me to move to, essentially. So I was very lucky to get an academic role at the National Hospital for Neurology and Neurosurgery at Queen Square, where I had a mixed academic and clinical role. I applied again that year and was very fortunate to end up getting an ST1 London number. And so that's where I'm at the moment. I'm at St George's, and we'll be moving to Royal London next year. So why do you want to do neurosurgery, or why do you want to be a neurosurgeon? This is, if anything, the most important question that you guys should ask yourselves during this presentation, and one that I really want you to think about if you're serious about going into neurosurgery. There are loads and loads of different reasons why neurosurgery is a great career, but it's important that you consider your own reasons and actually assess why you want to do it. I think it's quite common for people to think neurosurgery is quite a cool sounding job, quite a sexy job. You know, it impresses people when you chat to them about this sort of thing. And those are all the wrong reasons to go into it. So you should really try to get as much exposure as you can to it and work out specifically why you want to go into neurosurgery. Next slide. So, as I was saying, those are some bad reasons to go into neurosurgery, but there are loads of really, really good reasons to go into neurosurgery. I might be biased, but these are some of the reasons that I think it's an amazing specialty. So first things first, it's so cool. And that's all there is to it. And that's still one of my biggest reasons. You get to operate on the nervous system. It's literally the brain, the spinal cord. And that feeling hasn't really left me in terms of when I operate. I still leave some operations thinking that is absolutely amazing. And it still really excites me. There's a really, really broad case mix and a really, really broad patient base for neurosurgery. It's not geriatrics, where you're just looking after a small section of the population. It's not just pediatrics, but you see a huge case mix. So on one emergency list, you may do a shunt revision for a 1-year-old, and the next case could be Burhol's for a 95-year-old patient. So it's a huge case mix, big, big specialty. It's one of the few medical and surgical specialties in which you truly have life-saving procedures left. Most of medicine these days is about risk adjustment, medications moving forward. But neurosurgery, although it's at times rare, you do still get the opportunity to directly change the outcome of somebody's life. Now, the next couple of points are points that are quite important to me, but not necessarily important to everybody. Neurosurgery is a specialty with loads of opportunities for innovation, academics, and research. So it's a relatively young specialty, although in that picture we can see that some basic cranial surgery had been performed for thousands of years back in the medieval ages there as well. For the most part, neurosurgery hasn't been performed regularly apart from around 100 years ago. It's only a 100-year-old specialty when Harvey Cushing really started to revolutionize the field of neurosurgery. And because of that, there's still lots and lots of research, lots and lots of innovation that's still left to go. So there's a huge area within neurosurgery to go into academics. Building on that, if you're a hands-on person who likes gadgets, microscopes, etc., then it absolutely is the specialty for you. There's tons and tons of opportunity to have a play around with some cool kit, cool gadgets, and it's a really hands-on surgical specialty. It's an MDT type specialty. So not only do we just work with neurosurgeons, we also work with our physios, with our OTs, with oncologists, with radiologists, with a whole team. So if you like working in a team, it's fantastic. And finally, there's a really broad range of subspecialties. If you go to the next slide, Andrew. So these are some of the subspecialty options that are present in neurosurgery these days. And I think it really goes to highlight just how broad a field it is. There's functional neurosurgery, in which people look at patients with epilepsy, with Parkinson's, inserting deep brain stimulators, functional pain devices, etc. There's neuro-oncology, which is to do with tumors of the brain and spinal cord. There's neurovascular surgery, which tends to be aneurysms, arteriovenous malformations, and so forth. Pediatric neurosurgery with babies and children. Skull-base surgery, of which you can have anterior, middle, lateral skull base, but comprises a lot of tumors of the posterior fossa, things like vestibular schwannomas, meningiomas. And then there's spinal surgery, hydrocephalus, so the build-up of pressure within the ventricles in the brain, and trauma are all separate subspecialties. So loads and loads of different areas that you can go into. I've hopefully done quite a good job of selling it, but there absolutely are downsides. It's not a free lunch going into neurosurgery, and there are some bad things to consider as well. First things first, you deal with really, really sick patients who often have poor outcomes. Now, Andrea and I have first-hand experience of this. I'm sure many of you who are in the audience will have been on neurosurgical wards and seen neurosurgical patients as well. Patients can be really sick and they can go off very quickly. And you have to be someone who, not necessarily at the beginning, but who feels that they'd be comfortable with dealing with extremely unwell patients and making life or death decisions, because that truly is part of a standard neurosurgical on-call as a consultant. Training is long. This is one thing that absolutely is true. It's not a myth to dispel. Training is long, and you often have to do other aspects of training alongside it. So many people these days do what we call an F3, a year out of your F2, to try to get some neurosurgical experience. Often trainees have to have post-training fellowships. So this is 1 to 2 years in a subspecialty after they've completed their training. And that's with 8 years of training as well. So all in all, we're looking at sort of 10, 11, sometimes even 12 years training before you become a consultant. The lifestyle, I think a lot is made of this when it doesn't necessarily need to be. It's true that neurosurgery is demanding, both at a junior level and at a registrar level and at a consultant level. And it's something that you really have to love to avoid sort of becoming too rapidly burnt out. It's a career that ultimately you do give a lot to, but I think by and large things are improving in terms of the trajectory of life, work-life balance with it. The number of consultant jobs available in the UK might well be something that you guys have heard of. I know there's a broad mix of people attending this session, but essentially this is something that has been widely spoken about by the Society of British Neurological Surgeons, the SBNS, our main body covering neurosurgeons in the UK. It's no secret that there are relatively few consultant jobs, particularly over the last couple of years, and will likely be the case for the next sort of 5-6 years or so. Now, the SBNS has put in place a workforce plan, and they have tried to mitigate that as best they can by taking in reduced numbers of trainees for the past few years. So whilst that is definitely a problem now, in all likelihood, it's something that if you guys are successful in getting into neurosurgery and go through, it likely won't be a problem by the time that you get there. So please don't let that put you off. The final thing is that neurosurgery is a relatively small club. Neurosurgeons make up about 3% of all surgical specialties in the UK. Now, that can be good in terms of some things, but it also does mean that in terms of other things, like getting your voice heard as a specialty, at times it can be quite difficult. I thought before I go into the application process, I'd give a bit of an overview about the training pathway in the UK, and then give a bit of an overview of the training pathway for IMGs as well. But in the UK, I'm sure you guys know this, but if you don't, I thought I'd highlight it. So first things first, you go to medical school, you get your MBBS or your MBCHB or equivalent. Then you get your partial GMC registration, do your F1, F2, and get your full GMC registration. Now, the first time that you can apply to get into neurosurgery is in F2. It's the November of F2. Many people do apply to have a bit of a dry run, and many people do indeed get in from that stage, but lots of people feel that they may need to get a bit more neurosurgical experience and apply for neurosurgical SHO type jobs in an F3 and apply again. Now, once you're into training, it's a run through, which essentially means that that's it. You don't have to reapply, you're in. So it's a run through neurosurgery training from ST1 to ST8. At some point during your training, usually ST6, 7 or 8, you will do an exam called the FRCS, which is essentially your certificate for completion of training, your final exam. Once you've CCT'd, you are then allowed to apply for UK consultant neurosurgical jobs. This is a really brief overview of the CCT pathway for neurosurgery IMGs. So this is individuals who haven't gone to medical school in the UK. It's a slightly different pathway, but is largely the same once you're in at specialty training level. So I'm sure you guys who are IMGs will be aware of this pathway already, but the only slight difference is your foundation training sort of time, which is on the slide there. If you need to look these up afterwards, there are some really good resources online about getting into neurosurgery as an IMG. I've touched on these a little bit already, but in terms of exams during your training as a neurosurgeon, it's actually quite good. You have to do your member of the Royal College of Surgeons exam, which all surgical specialties have to do before they become a registrar. So that's MRCS. This is split into two parts. There's a part A, which is predominantly pathology, physiology, all of that sort of basic science type stuff, and it's a multiple choice question exam. And then there's part B, which is an OSCE style format, so an in-person examination of patients and assessment of technical skills. Now, those have to be done before you get to ST3. Many people choose to sit MRCS Part A in their foundation years, often F2, sometimes in an F3 year, which means that essentially before ST3, you really only have to do your Part B if you've done your Part A already. I've mentioned the FRCS exam. This is your final exam to indicate completion of training, and that's usually done at around ST6, 7, 8. So whilst training is a bit grueling, the exams that we have to do are by no means the worst compared to other specialties. Are there any questions so far at all, guys? I know I've spoken quite a lot about various bits and bobs there.
No questions so far, Simon.
Good. That means I'm answering them all clearly. So let's talk about the application process a little bit, because whether you're in F1, F2, or you're somebody who's in the first year of medical school, knowing about this is probably the biggest barrier to actually getting into to neurosurgery, and knowing about it early massively boosts your chances of getting in. So first things first, and things to know about. So there are some caveats to getting into an ST1 job, i.e. getting into training. So after you finish your F2, you can't have more than 12 months experience in any combination of the following. So neurosurgery, neurology, neuroradiology, neuropathology, and ITU. The reason being is they're so-called allied specialties, and it's really important that you're aware of this. before you go and do multiple post F2 jobs so that you don't time out. The other thing is that post F2, they recommend 24 months or less clinical experience. Now, these are things that I'm sure many of the people on the call won't be involved in at the moment, but I thought it's useful to sort of highlight these things just so that you don't fall, unfortunately fall into these traps without realizing necessarily. The neurosurgery person specification is something that sets out the essential criteria that you will need to apply to a neurosurgical ST1 position. Now, neurosurgery applications are run via the Yorkshire and Humber Deanery website. If you Google neurosurgery ST1 applications, Yorkshire and Humber, it will come up with a web page that will give you all of this information. But before you do go ahead and apply, it's useful just to have a quick look at the person specification and make sure that you meet the essential criteria, as well as having a look at the desirable criteria as well. So if you go to the next slide, Andrea. So there are some extra little bits in here as well that talk about desirable criteria that you can have in terms of things like research and audit and teaching, which give you a little bit of a guide to what you'll need for the application form. And next slide.
Simon, we've got 2 questions in the chat.
Oh yeah, by all means.
So the first question we have is from Yasir. He says, or she, sorry, I don't know. I want to ask about opportunities for international medical students in the UK. So do you have any idea?
International medical students in the UK. Well, do you know what? I'd suggest that the opportunities that are available to you guys are sort of the same as those that are here at the moment. The main thing, Yasser, will be going to your local neurosurgical unit, hanging around, showing that you're a willing, and keen student, and trying to get yourself involved with whatever sort of opportunities they throw at you, whether that be research, whether that be audits, whether that just be scrubbing in and going to theatre. But the first step is absolutely going to your local neurosurgical unit, whichever medical school you're at.
The second question is
there's also, yes, just to follow up on that, there are some really, really good organisations in the UK as well, like Nantzig and Brainbook, that I'll come on to later, that have some really, really excellent sort of opportunities and a really sort of well thought out pathway for international medical students. Is that all, Mo? Do you want to go back?
Yes, it says in terms of electives, the question is more focused on electives as a medical student.
Oh, electives. Oh, I see what you mean. That's always a bit of a difficult one, and not one that I've got direct experience in, actually. There are only so many neurosurgical units in the UK, so there's not a huge amount. And I imagine that if you find a list of the neurosurgical units in the UK and then subsequently find out who to contact with sort of elective opportunities at each of those, there'll be an email somewhere. And I'm sure if you ping them all an email, 1 or 2 will get back to you at least and say, yeah, we're happy to have you, in. So that would probably be the best way of going about that.
And then cool. Alexandra has a question as well, Simon.
Mm-hmm.
They're asking, could you go over the timing of when it is best to take exams such as MSRA, MRCS A and B again?
Yes, yeah, I can do. Well, I'll talk about what I've spoken about because I'm going to come on to the MSRA in a little bit. But the MRCS Part A, it really is down to you and when you feel that you're happy to take that. Some people do Parts A and Parts B in foundation years, which seems like an awful lot. They're quite difficult exams. But if you do that, that's great. It means more points when you get to the application. Personally, I sat my MRCS Part A in September of my F2. I had a lot of time to do it then. I was on a GP rotation, so it wasn't particularly arduous. And I managed to get that out of the way then. So I was quite happy with that. And I recently sat my Part B when I'm in ST1, which is quite a common sort of pathway to do it. Part A before and then Part B afterwards. Shall I crack on with the prayers for the time being, and then any questions I can pick up in a moment? Is that all right, guys?
Yes, absolutely.
Yep. Grand. Do jump in if there's any more or anything like that. You can go to the next slide, actually, Andrea. Thank you. Next one again, if that's okay. So that's just the selection criteria and eligibility criteria that's on the person specification, which I suggest you guys will go have a look at. Competition, again, before applying, is not something that we all like to hear, but it's something to be aware of before you go into it. Neurosurgery is really competitive to get into. It's not the most competitive specialty in the UK, but it's up there in the top 5. So recently, cardiothoracic surgery and community sexual and reproductive health have overtaken us as the most competitive. But by and large, for neurosurgical training in the UK, you'll be going up against 15 other people per place. So it's a 1 to 16 ratio for ST1 applicants. So nothing to put you off at all, but something to be aware of. This is the website that I mentioned earlier. And if you guys take one thing away from this talk, it should be this website, okay? Again, just go to Google, type in ST1 neurosurgery recruitment. You'll find the Yorkshire and Humber Deanery website, and it contains, as you can see on that side, all of the important documents that you'll need for applying to neurosurgery, all of the important dates, applicant guides, etc. And that really, really does give you the best sort of overview about getting into neurosurgery. So the application process itself, when does it start? Well, as I said, most people apply for their first application when they're in their foundation year 2 year. So they apply in November, and you'll have interviews around the sort of March when you're just finishing your F2. So that's when you can first apply. The application itself is made up of 3 main parts. So number 1, there's your paper application. This is basically where you write down everything that you've achieved in your portfolio so far and send it off essentially for marking. The second, and that happens in November usually. The second part is the MSRA exam, or multi-specialty recruitment assessment exam. This is an exam that's given to multiple different specialties, GP trainees, anaesthetic trainees, etc. And essentially is a way to add to your shortlist. So another way of essentially assessing the quality of participants. You'll then get a shortlisting score, and if your shortlisting score has reached a cutoff, i.e. you're usually within the sort of top 50, then you'll be invited to interview. And the interview usually takes place in around March or April after the November that you've submitted your application. So the application system, as I said, it's all done on this system called Oriel. Many of you who are in your final year of med school will be well aware of what Oriel is and how you navigate it. But for those that don't, it's basically just a computer system online that's a little bit clunky, but essentially it's used for specialty applications. There are several parts of the application. Parts 1 and parts 2 are fairly boring and quite quick to do. Part 1 is involving your personal information, equality and diversity stuff, employment history, all those sorts of things. Part 2 is your training history. So what jobs have you had so far? You have to put 2 references down, and then it's assessment of your fitness to practice. But part 3 really is the actual application, where you go through the nuts and bolts of your CV so far. So over the next couple of slides, guys, I'm going to give you a peek of what the application actually looks like. So this, again, I think is a really, really important thing to take away. And for those of you at any stage who are really, really serious about neurosurgery, it may be worth screenshotting these slides so that you can work out how you can best improve your CV. And this stuff is available to everybody. It's not some insider stuff that I'm showing you. It's essentially just a blank application form. So the application form is split into numerous different parts. Now, the first part, as you can see, is all focused on your undergraduate career. So there's your undergraduate research and audit projects, of which you can put a maximum of 5. And then there's undergraduate prizes and awards, of which you can put a maximum of 5. Now, that seems like loads, doesn't it? Particularly when you're thinking awards and prizes being really difficult things to get. These can be anything. They can be local medical school awards. They can be coming in, top decile, that sort of thing. They can be regional awards. They could be national awards for presentations and for audits, which are a little bit more difficult to get, of course. But those are the sorts of things that you can put on there. Similarly, undergraduate research and audits, these don't have to be, research projects that have ethical approval and have been published in the Lancet. These can be minor, small research projects that are done locally. But of course, if you're trying to maximize your CV, the thing to think whilst you're at medical school is, would I be able to fill out these boxes with 5 separate things? And it's absolutely okay if you can't. I certainly couldn't for some of those areas, but it's really, really important to try to aim to have 5 things. So whether that's research and audit, or whether it's prizes and awards. Next, again, just quickly to finish on the undergraduate stuff, clinical electives and attachments. Now, things like neurosurgical department attachment do count in this, but then voluntary electives and your medical electives that you do towards the latter end of your medical career at medical school. So things like going to another country. If you choose to go to a neurosurgical department and perhaps write up a little project whilst you're there, that's great. It counts as a really prominent elective point, and also will go into part of your undergraduate research or project. So you can double up on points by doing those sorts of things. The next stage is pretty factual, other degrees and diplomas. So these are things like MRCS, as we said, Part A, many people put there, BScs, BMed-Sci, etc. Postgraduate research is actually doesn't get you very much in terms of points. It's a score of either 0 or 1 point, but you can put multiple different projects in there based on your postgraduate research career. Similarly, postgraduate academic awards and prizes. So where have you presented? Have you won any local, national or regional prizes? That also goes there as well under your academic awards and prizes section. There's also a part here for postgraduate clinical courses, and I do think it's worth me touching on this actually. Courses are something that you shouldn't worry about at med school. If you're at med school now, this isn't an area of the application that you need to worry about. When you're in F1 and F2, you start to get access to some money from the hospital to go on courses. And it's also really, really good generally to sort of broaden your understanding of different areas by going on these clinical courses. There are courses that are typically really good for neurosurgery, things like ATLS, which is Advanced Trauma Life Support, Basic Surgical Skills, and then numerous other local or regional courses are very useful for the application. The next section is publications. So here you can list up to 5 peer-reviewed publications. You put whether you're first author or not, you put where they were published, etc., and you get points for them depending on how good they are as a set. I didn't have any publications when I first applied to neurosurgery in my first application, and I still managed to get a number. So absolutely, you do not need publications. And that's one of the biggest myths that I wanted to dispel during this talk, is that you need loads and loads of publications. You don't. I know quite a few trainees who still don't have any publications. So it's absolutely not an imperative. Presentations, these are things like poster presentations, either locally at your med school, regionally, or again at national conferences, particularly things like the SBNS or numerous different subspecialty presentations. And there are many of those that you can go to. So if you pair your undergraduate research with some presentations and submit them to different conferences, you'll end up filling this up fairly quickly. Clinical audit and service improvement. So these are postgraduate things. Now, again, in the most recent application form, you can put up to 3 clinical audits or quality improvement projects. Bonus marks if they're neurosurgery related. And these are things for you F1 and F2s to be thinking about doing, or people in final year of med school as you go into F1 and F2. Think, can I get some neurosurgical audits or quality improvements under my belt? Now we get onto the stranger part of the application itself, where there's a bit more wiggle room for what you can put. Organizational and leadership skills, you get either 0 to 3, so you can get up to 3 points for this. So it's quite a big area. And you're allowed to put up to 5 things. So with this, it can be sort of leadership roles that you've held. It can be committee work. It can be societies at medical school, things like, leading a sports society or being, chairman of a society or something like that, or even minor roles in these sorts of things will all count for something. Again, bonus marks if they can be neurosurgical related, if you were part of a neurosurgical society at medical school, or are you a part of a wider society like NANSIG or BrainBook that has national and even international activity, and then that looks absolutely fantastic. Practical and psychomotor skills really is a bit of a strange one, actually. So here you can provide details of activities that they think highlight your practical and psychomotor skills. Now, this really is the most interesting bit of the application because you can put absolutely anything that you feel demonstrates those skills. So I know of people that have put gaming, with evidence of saying that they were in the top 2% of players on Fortnite at one stage, and that will score you points. There's things like, I tutored at a suturing course and things like that, which tend to be useful as well. They perhaps sometimes this area is seen as an area to fill with non-neurosurgical or non-medical and surgical type things. Sport is really, really good for this section. So, golf, tennis, football, all of those sorts of things are really, really excellent to stick in this section as they demonstrate good psychomotor and practical skills. Now, if you're reading this and thinking, well, I don't have any of those sorts of things that I can put on there, there's absolutely time to change that. Things like painting, things like taking up a sport, hobbies, crafts, all can go in this area. And it's a bit cynical to take it up for the neurosurgical application, but that's what people do. Teaching, finally. This is, again, a big section, so up to 3 marks for this. And you can put up to 5 things. So it really, really is important to try to max this section out as much as you can. Now, teaching falls into your undergraduate and postgraduate level. So undergraduate, did you hold teaching sessions? Were they neurosurgery focused? Were they just surgery focused? You get bonus marks if these are on a sort of wider level versus if they're local or regional. So if you host a series of talks on neurosurgery that reach an international audience, then that's fantastic. That'll be top marks for one of your things that you put in there. And similarly, if you can, show that the teaching intervention that you had a sort of genuine impact on people trying to get into neurosurgery or neurosurgical related things, then that's again a real bonus mark. So that's the application form. There is a lot to go through there, guys, and I know that I spoke quite a lot about those things, but I think just seeing that from your perspective should hopefully be really, really useful in terms of prepping you and thinking, how can I actually work towards getting a neurosurgical number, and which of those areas can I focus on at this stage in my career? So back to applications. There are 3 personal questions at the end I should mention just to finish off applications. They're typically things like, why do you want to go into neurosurgery? And you have about 200 words to write your reasons why, and they're scored as well. After the application, you submit it towards the end of November. You then have a long wait over Christmas, and early January, they let you know when the MSRA is. So the MSRA is an exam that I'll talk about on the next slide. So many of you will have heard of the MSRA. It's the multi-specialty recruitment assessment. It's basically a computer-based examination that assesses knowledge and skills acquired during foundation training, as well as your professional capabilities and decision-making. This isn't a hard exam in terms of, crazy difficult sort of level. In my opinion, it's sort of at the level of final year med student level. And the professional dilemma component are very much like the SJT, although I'm not sure if that still happens anymore, or a situational judgment test. There's lots of controversy as to whether the MSRA actually is any good at detecting whether applicants are very good and whether it's a good exam to give or not. Essentially, HEE have suggested that it's a reliable and valid way of assessing large number of candidates in a standardized way with limited clinical and administrative resources. And you can sort of read into that what you will, but it doesn't really matter whether it's a good exam or good true reflection of the applicant, because we have to do it. So you have to do it, and you have to do as well as you possibly can in it. The MSRA accounts for about 40% of your shortlisting score. In terms of tips for how to revise for the MSRA, again, it's the sort of thing that you'll do during your final year med school. Sort of level that you get in final year of med school. So going over your previous notes from med school would be really, really useful. But also there are huge question banks. It's an exam that's sat by loads and loads of people. So there are numerous different resources available to you. Good. So you get the MSRA done. That's done in sort of mid-January. And then you've done the 2 big bits, your application, your MSRA. So you now are left with a shortlisting score, and they'll tell you your shortlisting score. It's out of 140. I believe around 92, 94 is the cutoff for interview, but they invite around 50 people for interview. And that's the next section of deciding whether you get a job. So getting an interview is a huge achievement in and of itself. And if you're somebody who's in F2 or younger than that at the moment, if you're thinking about your first application, just think to yourself, I want to get an interview, because that will give you a huge wealth of experience going into applying next year. And it is a fantastic achievement to get even an interview from that sort of position. I've heard lots and lots of trainees say, myself included, say it's all about the interview. And that is totally true to some degree. It's important that you do well. in your MSRA and in your application. But if you have, an average application and then you have a dynamite interview, you're in a really, really good position to go on and get a number. So prepping for the interview is really, really important. Interviews used to be held in person, and this was a few years before I joined. And essentially, it would be numerous different stations, clinical scenarios, management and problem solving scenarios, as well as CV and understanding of specialty scenarios. But also, along with that, they would have practical skills scenarios. So can you suture up this wound? Can you use this operating microscope? Lots and lots of areas to sort of prep for. Now, when COVID happened, they moved all of their interviews to online, and there are benefits and there are negatives to that. But now it's essentially a 30-minute interview with 10-minute stations, 3 10-minute stations. One of them is on your CV and understanding of specialties. They might ask you about your application. They might ask you, why do you want to do neurosurgery, and ask you some problems or, common dilemmas that are pertinent to the modern neurosurgical landscape. The clinical scenario is then typically junior neurosurgical SHO sort of level. So it's not something that's overtly difficult. It's typically on a common neurosurgical presentation. And then finally, after that, we've got management and problem solving. So this is typically a situation where they're trying to assess how you work under pressure and essentially looking at your understanding of sort of common ethical areas in neurosurgery. So a typical thing would be, how do you prioritize these 3 emergency bleeps? You go to see one of the patients, something else bad happens, then something else bad happens, and they're looking at how you manage that sort of situation and work under pressure. I can see there are a couple of questions, actually. Do you want me to pause and just see if I can answer some of them as we go?
Yeah, I was just going to ask you if that's okay. There were 2 before. I think you've answered them, but I'll let you answer them again. One of them was from Neuron, who asked best time to enroll/apply for training for IMG neurosurgeons.
So there are a couple of tenets to that question. First of all, Neuron, I've been talking about the specialty training route, whereas there is another route, which I'm sure you guys are aware of, called CSER, which is essentially out of program training. And you don't have to worry about the timing out with those sorts of things. It's essentially compiling a list of your own capabilities, as well as your own sort of targets that you've hit, akin to what you would do in a neurosurgical training program, and demonstrating to your seniors that you are of sufficient quality and safety to practice. And that is absolutely a viable route in the UK. Best time to apply for training. So I won't go back there now, but there was a figure that I showed earlier that looked at how the sort of timings to apply when you're an IMG. So once you've got your foundation year sort of competencies out of the way, or whether you do your year since joining, that's equivalent to your foundation years, then you're eligible to apply just like everybody else. So not too much difference to the normal ST1 pathway, I'd say.
Brilliant. And the second question, there's 2 more, I think. Yep. The second question was, are you not able to apply for ST1 after 2 unsuccessful applications after FY2 because of the 24 months?
So there are many, many ways around this. So if you are just doing purely clinical jobs, then yes, you'd be absolutely right. You wouldn't be able to apply for an ST1 job after 2 unsuccessful applications, because you would time out in terms of your clinical exposure. And in all likelihood, if you wanted to do neurosurgery, you would have been working in the neurosurgical department. So you would have timed out your 12 months of neurosurgical experience. I know many people that have been in that sort of position and are, excellent junior neurosurgical SHOs who want to go into training. And there are ways around it. So you can go into a research role, you could do a PhD, you could do a master's. There are several other things that you could do essentially to delay yourself timing out that aren't clinical and aren't in those areas. So there are options.
Okay. And one of them is from, again, Alexandra. They're asking, does doing an attachment in the penultimate year count as well towards the attachment section?
Well, in a neurosurgical unit or something like that? I imagine so, yeah, absolutely. With these sorts of applications, it's how you sell your attachment as much as anything. But yeah, absolutely. If you were doing something in a neurosurgical department, that really would that would count, and you'd be able to put it in, and you'd be able to sell it as, you know, I observed patients, you know, in life-saving situations, and you really make it sound good, etc., etc. Yeah.
I think there's one from Glenn, but we can answer at the end because that's about your personal experience and your sort of.
Sure.
How
Okay.
you done
Well, there's not too much left actually, guys. So I should hopefully hit around the half-hour to 40-minute mark that I promised. Next slide, please, if you could, Andrea. So, how to prepare? What should you guys do? The most important thing, I think, at the moment is to enjoy what you're currently doing. Don't stress about this too much, and please don't become one of these gunners that just lives for neurosurgery and that's all they ever think about and do, because there are those people that exist, and you know, sooner or later people find out that there's more to life than neurosurgery. So my advice for this section really does depend on what sort of stage you're at in your career. For people at med school, enjoy it. Try to get some exposure to neurosurgery, try to do some electives, some shadowing, some taster weeks, and essentially try to get to know the team so that you might be offered some research projects or an audit, but most importantly, be keen, get into theatre, see what it looks like, follow the consultants, you know, think to yourself, are these people happy or sad? And think to yourself, would I want to do this? If you're in F1 and F2 and you're really serious about doing neurosurgery, then hopefully you'll have been doing some of those things already. But if not, it's absolutely not too late. You can still apply to neurosurgery and go ahead for it. But you will be a little bit more time pressured, and there is sort of a bit of a shift of focus. You'll need to start thinking about going to courses like ATLS, BSS, CRINTS, Care of the Critically Ill Neurosurgical Patient, and start to think about how you can really maximize your points on your application. Know how to score points. As I said, that application that I sent through, read through it lots and lots of times and start to think to yourself, what am I not doing so well on? What can I boost? Are there things that I could, you know, do one project and it'd count as two things? It would count as a presentation and as research, etc. And if you're in F2, so if there are any F2s, yeah, I'm not sure if there are, definitely apply. Some people say, oh, I don't want to apply, I'm not sure if I'll do very well. Definitely apply. It's really, really good in terms of getting general experience of the application. And then also look for fellowships. So this is on nhsjobs.co.uk, where essentially you can look to see if there are any fellowships for F3 positions if you don't happen to get a number, which is a really useful backup plan and will give you direct neurosurgical experience. So finally, just some useful resources. The SBNS website. So SBNS, as I've said, the Society of British Neurological Surgeons, they are the governing body of neurosurgeons in the UK. They have a really, really useful section on getting into neurosurgery. If you just Google getting into neurosurgery UK, there are a range of papers published by a good couple of friends of mine, but also by, you know, on numerous other different websites that give a really sort of clear pathway of how you can get in to neurosurgery. And basically tell you what I told you in this talk, but with a bit more detail and a few fancy figures. So that'll be really useful for you guys to have a look through. There are numerous different neurosurgical societies. There are national charities like BrainBook and NANSIG. I'm sure you guys know about them already, but if you don't, look them up, follow them on Twitter, and just sort of dial in to whatever they're doing so that you're aware. And they also offer a range of really, really useful research opportunities as well for any sort of junior level or med student level people who are hopeful to get into neurosurgery. University clubs is important as well. So if you have a neurosurgical society or a surgical society, by all means get involved and join that. As I said, these sorts of things don't feel like they matter at the time, but they do make up some of the points when you're going into your applications. Yeah, next one, if that's okay, Andrea. So to summarize, guys, enjoy your life as is. Please don't become obsessed by neurosurgery to begin with. Question your reasons and your goals. I think it's a really, really important thing. Do not go into neurosurgery just because you think it's cool. You know, when you're at the end of a 15-hour shift, you won't be thinking it's so cool then. So go into it for the good reasons. I'm sure that you know this already, but understand what's expected of you during applications, and do try and go into some of those resources that I've highlighted so that you get a better idea of what to expect. Attend all things neurosurgery, look up webinars. You know, NANSIG and BrainBook do many of these sorts of really, really cool things where they have seminars, etc. You're all attending this now, so you're all clearly a group of motivated people, but try to expose yourself to neurosurgery as much as possible. And then finally, if you can, without stressing out too much, try to start ticking off some of those boxes now on the application. I thought I'd just run this FAQs thing really quickly. Hopefully some of your guys' questions might be answered here. When should you set MRCS? We've answered that already. It depends. Part A can be done at many different times. Part B can be done at many different times. I did my Part A in foundation years, as I've said. Do you need publications? Hopefully I've already proved to you guys that you don't need to be some academic whiz to get a number in neurosurgery. I know a few trainees that don't have any. And as I said, I didn't have any in my first application and I managed to get a number. Does it matter if you didn't come top of your year? Can you still do neurosurgery? It literally doesn't matter at all. You could be bottom decile and it would have minimal bearing on your application. You guys have seen the application form. There is no point, does it say, where did you come in your year? If you come top of your year, then great, that looks fancy and you can put it in your prize section, but you don't need to highlight this, the fact that, you know, if you're not top of your year. Are there really no jobs in neurosurgery? Hopefully I've cleared that up a little bit. Not so many at the moment, but I think, and I'm hoping, and there's certainly a clear workforce plan in place that means that in 5 to 10 years, there will be many more. And there are jobs at the moment as well. It's not as if no consultants get employed. Do you have to have done neurosurgery in F2, F3 to get a number? No, you don't, but I would suggest you do. Going into neurosurgical ST training without any neurosurgical experience would probably be a bit of a challenge. So try to get some experience. And is it true you never get to operate neurosurgery? It's absolutely rubbish. You do get to operate. It's all about how much you put in and how much you want to stay. I'm coming to the end of my ST1 year now. I'm just approaching 100 cases for the year. And it's been a pleasure operating there. So you do get to operate. You're not going to be doing some complex tumor removal in the brain, but you absolutely do get a chance to operate. Any other sort of questions?
Yep. So there's Glenn asked this question. They said, would you be willing to chat briefly about how you personally satisfied the domains listed in the shortlisting matrix?
I mean, yeah, I can. I'm concerned that will take quite a long time running through my entire application, essentially. As I did my undergraduate intercalation. I worked in a couple of research labs as part of that, so that ended up filling the undergraduate section quite quickly. I'd done an audit, and I'd done, as part of my elective, had done a quick research project looking into traumatic brain injury. I had a couple of prizes, and as I said, didn't have any publications. I'd run a teaching course locally for medical students. I'd done some bedside teaching. What else had I done? Those sorts of things. I was part of some societies. I was treasurer for a squash society. All of those things involving hand-eye coordination. It's fairly difficult to sort of run through the whole application, I'm afraid. But yeah, that's the sort of nuts and bolts of it.
Brilliant. And we've got one more. So Alexandra says, thank you for answering all the questions. They've been lucky to secure an elective and surgical rotation in neurosurgery in their final year of medical school. Do you have any tips of maximizing their time in neurosurgery?
I think do you know what? I think the most important thing will just be showing up, being keen, hanging around. It can be quite frustrating on electives sometimes because you're obviously, you're not a doctor yet. You're not sort of being kept busy with prepping patients and things on the ward. So sometimes it can feel like sitting around a lot, but by all means do sit around and wait for those, those cool operations, hang about, see what they do on the ward, and generally just really, really get stuck in. If you're someone that's really willing to help, even with minor things, moving patients from one ward to another, wheeling beds through, that sort of thing, then people will really, really notice that you're a someone that really wants to be there. Other things, I'm sure you guys know this already, but if you don't know how to scrub into theatre, perhaps watch a couple of YouTube videos and ask some of the scrubbing team at the hospital that you're going to show you how to do so. And yeah, generally be nice, be friendly, be keen, and they'll definitely have you along.
2 more questions. So one is from Yasser. They're saying, is the journal like the Surgical Neurology International Journal good to publish papers in?
There are a range of I mean, there's loads and loads of fantastic journals. And to be honest, when you guys are at your stage, perhaps being at medical school, I would try not to worry too much about the impact factor or the prestige of certain journals. It's a real achievement just to get a publication out there in a peer-reviewed, respected journal. So, yeah, I can't really comment on individual journals, I'm afraid.
That's fine. And one more question from Nuran: are you less likely to get into ST3 than if you start from ST1?
So, as I said, it's a run-through program. So you start at ST1 and you go all the way through. There's no reapplications for ST3. There certainly was last year. I'm not sure whether they'll do it again, but we previously had applications for an ST2 post. Now, these are people usually who have good neurosurgical experience, have done core surgical training. So they basically have operated a lot and have a really, really prominent amount of experience that means that they can skip the ST1 year. Now, that's quite rare. And because of that reason, only one number was offered last year, and it's generally been like that for a long time. And that means that the competition ratio for that one last year was 48-1. So what happens is you end up with 48 people who are all pretty good, junior surgeons who can operate, have had lots of experience, all applying for one job. It's insanely competitive. So for the most part, I'd focus on the ST1 application.
Excellent. I think there are no more questions. So I think we have reached the end of our webinar. I hope that everyone learned something useful today and that you have enjoyed our first webinar. But most of all, I wanted to thank you, Simon. It was a brilliant, complete, it has been the best webinar about applications to neurosurgery I've been in. Very complete, the questions, very interesting questions as well. So thank you very much for coming and share a bit of your time, your experience, your first-hand experience with us. It's really appreciated.
Thanks, Andrea. Cheers, guys.
Thank you, Simon. So thank you, everyone, for joining us as well. I hope I will see you again in 2 weeks. Just a reminder that the next session will be on the 17th of July, and we are going to hear about neuroanatomy and interpretation of scans from the consultant neuroradiologist, Dr. Andrew Falsom from St. George's Hospital. Thank you very much, everyone, for coming. And remember, you will receive an email with the feedback form. Have a lovely evening. Bye-bye.